Interesting. But not every day is normal now, is it? Now, if you wouldn't mind telling us, what happens on an abnormal day? What are some extreme circumstances that you might face in your function to help preserve the body?
Because I don't have a nucleus. As I get old, I can't repair myself. I can't make any new proteins, and over time I become a bit less flexible. My job is hard, circulating around the blood with its blood pressure over and over again. I only live about 120 days. Old red blood cells can burst in circulation, or, when they get to the spleen or to the liver, be unable to fit through narrow capillaries, and there are macrophages, some white blood cells which are ready to perform phagocytosis of old worn-out red blood cells.
Well, an abnormal day would be a serious infection, especially one by bacteria. See, when I do phagocytosis, sometimes I perform so much phagocytosis and fill myself with so many microbes that I then have to kill myself. Alright, I contribute to pus. When you find pus at a wound site, it's the neutrophils, including many which have burst, which form much of this pus. In fact, some other blood cells known as monocytes might actually perform phagocytosis of me at a wound site after I ingest so many microbes. That's what happens during an infection. Sometimes I only live a couple of hours, 2 or 6 hours during an infection. Life is so intense at those moments.
Well, an abnormal day is when I get activated by signals from other cells, such as a lymphocyte. When I get activated, I release my granules, which will then promote inflammation and be toxic to a parasite or cause the tissue to remodel. In some cases, I actually accumulate in parts of the body I'm not normally found, like the skin or the lungs, and here I might cause some problems. So the reorganization of tissues I promote are often a factor in asthma as eosinophils accumulate in the lungs. That's what happens on an abnormal day for me.
On a bad day, I am activated and will release my granules, causing inflammation. Perhaps this has occurred when something has bound to those IgE antibodies on my cell membrane. Monocytes can have bad days. For example, unfortunately, monocytes, which become macrophages, can ingest far too many lipids in the blood vessel linings of those who have lipid disorders. And as a result, the plaques, which can help to block the lumen of an artery to a large extent, can be what are called foam cells. These are macrophages which have ingested far too many lipid. So, that's an abnormal scenario which can unfortunately cause quite a problem for the body.
On an abnormal day, however, lymphocytes then become activated. Now, this involves teamwork, where perhaps an antigen-presenting cell will approach a lymphocyte, or a T helper lymphocyte might approach a B lymphocyte. Very often there's a lot of teamwork involved before lymphocytes go into action against an infectious agent.
On an abnormal day, I contact collagen after a cut or an injury, and as a result, I release my granules. This will then cause me to change my shape and to help form a platelet plug, and will help to form a clot in that area. That's what happens on an abnormal day.